Good morning, everyone. My name is Aaliyah Bhatia. I'm the executive director here at Vot-ER. Well, one part of my role is to celebrate the incredible work of Vot-ER's team and partners. Another is to ensure that in our work, we build a broad cross-disciplinary coalition that bridges a variety of disciplines in health and medicine. We are so excited that in addition to Dr. Maybank and the AMA, we also have perspectives from nursing, social work, and medical education here to connect the values of each of these interconnected disciplines to civic engagement. Joining the stage with Dr. Maybank is Eleanor Zambrano, Shauna Butler, and David Scorden. Eleanor Zambrano, affectionately Ellie to us at Vot-ER, leads the Center for Innovation in Social Work and Health. The Center for Innovation in Social Work and Health is dedicated to expanding the impact of social work in healthcare and public health spaces in order to improve the health and well-being of vulnerable populations nationally and globally. With over 20 years of healthcare nonprofit experience, Ellie champions the relationship between social work, health, and voting, and is a dear friend of Vot-ER. Shauna Butler is a nurse economist, managing director for Exponential Medicine Conference, creator and host of See You Now, produced in partnership with Johnson & Johnson and the American Nurses Association that features human-centered, nurse-driven solutions to address our most challenging healthcare problems and to transform our health systems and practices. Butler's career centers on raising the visibility of nurses, empowering them as system-level change agents, and recognizing how they create and drive clinical and economic value. She ignited a global conversation highlighting the rarity of nurses in boardrooms, product designs, innovation teams, policy development, tech conferences, and health media. In 2021, Butler was honored by Rock Health as a top 50 in digital health. And when she's not doing any of those 50 things, she's also helping make sure Vot-ER connects with the types of folks who can help us teach us how to be better and stronger in our work and more and more design friendly. Dr. David Scorden is president and CEO of the Association of American Medical Colleges, which represents the nation's medical schools, teaching hospitals, and health systems and academic societies. When national protests erupted over police brutality, Dr. Scorden was an outspoken voice for ending systemic racism in academic medicine and addressing persistent health disparities. The Association of American Medical Colleges recently released guidance in partnership with Vot-ER, encouraging medical schools to support both their students and patients with nonpartisan voter registration. Over 75 medical schools this year are hosting Healthy Democracy campaign teams, and we are excited for the impact that they will make. And I will hand it over to your moderator, Dr. Maybank.
Wonderful. Thank you. Thank you. Thank you. Good to be here, everyone. It's an honor to be on this panel. We have agreed beforehand that we are going to go by first names. I think we're all okay with that. So it's good to be here with Ellie, Shauna, and David. So I'm excited to be in this conversation. So I'm just going to start off because I host prioritizing equity every month. And I usually like to start off with really, how are you doing right now during this time as leaders, as family members, as physicians, nurses, social workers, how are you doing? So I'm going to start with Ellie.
Hi, everyone. Thank you for having me today. I'm proud and honored to be here. I'm here sort of representing the Center for Innovation in Social Work and Health. And today in this moment, I feel really proud and excited about the work that Vot-ER is doing, seeing this sort of interdisciplinary representation in understanding the needs around changes in healthcare and trying to institutionalize our values around health equity. The center itself has been focusing on an interdisciplinary sort of approach to changes in health and public health. We believe that social workers are well positioned and have strong relationships with physicians and nurses and health policy leaders. And we feel really strongly that this is a wonderful space to be in, and we hope to build these partnerships and engage, longer term relationships around this work.
Fantastic, thank you. Shauna, how are you, and where are you? You look like you're in a field of beautiful purple flowers.
Yeah. So I wanted to give people a visual cue. I'm in Austin, Texas, and I start out by saying that, first of all, I'm grateful So many people are challenged, suffering. We've seen 2 years of a pandemic. So I start out with being grateful. And then that's generally followed by being outraged. So many of the disparities that we've seen, it brings out a sense of outrage. And within that, then I'm also worried, when I think about what is going on with our policies, who's being left out. So I do feel a sense of worry, but I also feel a very great sense of strength. When I look at my colleagues, when I look at neighbors and volunteers, activists, advocates, I'm reminded very much, Aletha, when you held up the picture of John Lewis, I had the good fortune of meeting him first when I was 5 years old.
Oh,
I had
wow.
the good fortune of living in a voting district where I got to vote for him. And on many occasions got to feel his generosity of spirit and conviction and commitment, enduring, where he talked about getting into good trouble. And I've been doing that all my life, thanks to him. So, and I also wanted to thank you for your comments and for your work and everything that you said when you were referring to the work that physicians are doing. This is the exact same level of commitment that nurses, social workers, and oftentimes we leave out dentists and pharmacists
Right.
and hearing specialists. Our eyes and our mouths and our ears
Right.
are very much part of our health. And within every single one of these disciplines, there is a level of need, capacity, and willingness to be a part of the health equity work. So I just wanted to make sure that when you're speaking to that, that we know that this is
Absolutely.
everybody on the health team who are doing those. So yeah, I'm grateful, I'm outraged, I'm worried, and I am very committed. And I find joy in knowing that I have partners who are happy to join in this work.
Thank you for that, Shauna, and thank you for the accountability, always.
Mm-hmm.
It's part of that solidarity. It's important,
Yes.
right? David, how are you doing?
Wow, I could only just repeat what Shauna said. I'm feeling exactly the same way. But a couple other things I wanted to add. Aletha, at the risk of embarrassing you, I
Oh,
want
boy.
to share my gratitude to you. We're standing on your shoulders as well.
Oh,
And it's important to say that today and for us to recognize that. I want to say a little bit more about my gratitude to Vot-ER. I put in the chat a minute ago or so a link on our website. Thanks to the Vot-ER folks, we have a fact sheet on our website that people can use if they say, "Well, can I really do this? Can I do voter registration in my hospital, clinic, whatever?" And thanks to the folks at Vot-ER and some folks in our Center for Health Justice that Aletha was nice enough to mention. That's a good link if you ever want to pass that along to anyone. It's just a fact sheet. You all know this, but for people who maybe haven't bumped into it yet, I think it's really important. Aletha, I didn't know till this morning about your mom, but my dad also was from somewhere else, from Eastern Europe. And he came much earlier. He came over during the Spanish flu pandemic. And he told me, don't let me ever hear of you missing a chance to vote.
mhm.
And so that was one
Right.
thing that got me very interested in this. And the second is, when I was at the Smithsonian, I had the amazing privilege of being just somebody in a long list of people helping to do naturalization ceremonies. And remembering that my dad became a naturalized citizen, I got to shake the hands of the people who were coming across the stage. And I got a chance to just whisper to them as they were going by, "Remember to vote, remember to vote." And it's interesting, they didn't need me to tell them that, but I was doing that for my old man, Aletha, to know that he would have said, "Hey, you're getting the privilege to do this. You better just remind people about this." And then finally, I want to state my gratitude for the learners of the world, for the med students, undergraduate college students, residents, and others. And this is going to be a big shock. They are not waiting for my
No.
generation to tell them what to do. I know that's a big shock for y'all,
Yes.
but they're not waiting. And a lot of the progress in these areas, including the organizing and the activism, really comes from that direction. So sorry to be so long-winded, but that's what I'm feeling today.
Well, thank you. And thank you for sharing your story.
I
So
just
go
wanted
ahead.
to add on that real
Please
quickly,
go.
the naturalization ceremonies. Not many people
Yeah.
get to be a part of them, and I have been part of 2 of them. And it isn't really until you go through that process, because most of us are born into, the citizenship that we have. But when you have to apply and then you go through, it is really, really powerful. And having lived the life of an expat and also having 2 adult children, women who are expats, the voting piece, we have that other discussion of you still have that right and that opportunity and that responsibility to vote, even when you're not in this country. And then when you live in a country where you don't have that privilege and you've been through that, all of those things are so powerful and poignant to remind people that this is a responsibility and an opportunity that travels with you, no matter where you are.
Thank you for that. Ellie, going to come to you. So I also agree that the interdisciplinary opportunity we need to expand on more and more. And I'm glad to be in conversation with you. I want to have a sense of like, how can social workers, you engage a lot with social workers. What is the role that you're finding that they're tending to lean towards through civic engagement? So social workers have had a strong context of social justice for a very long time. I would say so have nurses, but definitely social workers. And so what are they doing now at this point, and kind of what are the challenges that some are facing within their organizations, as well as the opportunities to do this kind of advocacy and organizing?
Thank you for that. Yeah, public health social work is a perfect fit for today's discussion. We prioritize social justice and anti-oppressive practices to achieve health equity, and we do it through strong leadership as a way to be an agent of change. We talked probably throughout this conference around how in the US political determinants of health, including voting, government, policy, that a lot of these policies haven't really been reflected of the changing population, and the elected leadership as well and policy really lack this type of diversity. Social workers and healthcare professionals are so well positioned to join forces to promote civic health engagement through their leadership and patient engagement, encouraging and engaging individuals to get involved and make their voices heard in the decision-making process. Will lead to healthier communities across our country. If we help to create this type of equity, we also need to galvanize more social workers to explore how they can impact healthcare policy. Social workers are in various spaces: academia, healthcare, public office, social policy advocacy, and this helps with their positioning. And they've always understood the importance of voting to political action, power, social change. Since the founding of the National Association of Social Workers, NASW, in 1955, the organization has always promoted open access to voting in the ballot box. But right now, what we're seeing is a growing of social work within healthcare settings. Social work is one of the largest growing workforces in healthcare, and over the next 20 years, we'll continue to see that. Engagement and education is part of our social work code of ethics, and we can focus on empowering our patients and the communities that we work in. Some of the challenges that we face is whether or not social workers are focusing on political and legislative advocacy in their roles. But it's important to communicate that under state and federal law, nonprofits like social workers and healthcare providers can conduct activities around voter registration, education. They can discuss federal and local policy. They can talk about budgetary issues and regulatory issues, and that includes ballot questions, and take appropriate advocacy and action. So as long as they remain nonpartisan while they're doing all this, and they can also get in touch with their federal relations or government affairs office as a way to stay nonpartisan itself.
Yeah, thanks for that. And so thanks for those, the kind of the strategies or the language and the facts actually that you provide, social workers on why they can do this and how they can do it. I'd like to actually hear from both David and Shauna about what they do in their environments for the same thing that comes up amongst their disciplines, you know, when you start to hear, well, how can we do this? Are we allowed to do this? You know, what is that talk? Like, what is the talk that you have? Everybody has different talks for different things. And so how does your talk usually go around encouraging, you know, your fellow colleagues, you know, that this is the space for them to be? Shauna, I know I'm going off script, but it was, to me, I'm really curious to kind of have a sense of that. So Shauna.
Yeah, so I'll put in the chat the ANA, the American Nurses Association Code of Ethics. And there actually is a Center for Ethics and Human Rights, or I might have it backwards, Human Rights and Ethics. But this is very much a part of the nursing practice, the nursing responsibility, that code of ethics. And while it may not say specifically civic engagement, it talks about self-determination. It talks about promoting health and wellness and access. So on every single point that is part of the code of ethics and what the practice, the professional practice is, this fits squarely at the center and at the heart of what nurses will do. And so oftentimes, you know, it's interesting that the conversations that I am having with my colleagues, it's more, how can we do more? And nurses have had a long-standing tradition of activism and advocacy. And I want to call out one population in particular. It's children and kids, people who are not eligible to vote, who don't have an income, who are completely at the mercy of these policies and the people who put them in place. So I see really, really strong advocacy on any number of these issues around policy, voting, in particularly with children. And there are two things that I want to point out on this. We talk a lot about the social drivers of health, the political determinants, which I think oftentimes it more is a determinant as a driver. But we talk about it in the spaces of people where they live, work, learn, pray, and play. What is left off is where and how people die and bereave. And so much of our policies and our practice are centered around end of life, palliative hospice care. So I just wanted to, you know, lift that up. This is a space where nurses spend an enormous amount of time and are regularly advocating. So I haven't seen too much of a reticence to, should I be participating? It's more, how do I participate? And specifically on the places where people are not eligible or where it's really, really hard to make voting happen, whether that's a language barrier, a disability, a refugee status, somebody who's been incarcerated or is incarcerated. Those are the people that they really ask, like, how do I help them the most?
I appreciate that. David, perspective from you, because you have several audiences as well.
Yeah, so I agree with everything that and salute everything that Shauna just said. And not to be a downer, but I just want to bring up a couple more issues. In your slides, one of your slides, or a couple of them, Melitha, you talked about the kind of pushback that you get and some of the things like, where's the evidence, you know, blah, blah, blah. I think it's important. And one thing that I tell people, whether it's an individual or an institutional representative, is to expect that kind of stuff to happen and to take care of yourself, because even if you expect it to happen, at least in my case, I won't speak for anybody else, it's tough to get that pushback. And the more you get, the tougher it is, not the easier it is. And in a small way, Aletha, like the pushback that you all have gotten at the AMA, we've just published, after 2 years of work, which you were a part of, diversity, equity, and inclusion competencies for the medical school curriculum. And they're going to be, I believe, very widely adopted. And let's just say we heard about a lot of those things, some of them by editorial board of a big newspaper and others, you know, in other fashion. So one of the three things is to tell the people, expect some pushback, even if what you're doing is nonpartisan, even if what you're doing is clearly evidence-based, it doesn't mean you won't get pushback. And you have to take care of yourself, period. Not everybody, you know, thinks about taking care of themselves, unfortunately. And I worry about the health and the mental health and the fatigue that can happen for people working in this area. So that's one. Secondly, the differentiation between individual and institutional things. And for public institutions, of the many, many institutions that are members of these kinds of associations, there are real constraints on what they do based on sometimes the threat of changes in funding and so on. And it's important that we recognize that and help people to find ways to be effective. And then thirdly, what a couple of colleagues already said today is to lean on each other, not only in settings like this that unfortunately don't happen super often, but to lean on each other by networking outside of the big meeting that we're having today, so that we have a way to ring each other up, so to speak, and say, you know, how do you deal with this, whatever. And I've learned a lot from other people, more than I've imparted to them, about how to deal with that kind of pushback. So those are the kind of things that are spinning around in my head, Aletha.
Thank you.
If I could
Go
just,
ahead. No, please go ahead.
I wanted to just sort of think about, David had talked about this idea of fatigue and really understanding the role of self-care in, you know, thinking about how we can become advocates, agents of change. And I think that, you know, social work has been sort of leading in many ways to talk about self-care and understanding the importance of sort of well-being and overall health, whole health. I think that it's really important for all disciplines to think about this, especially if we think about how does someone get involved? What are the challenges? And often it's a lack of resources, because many of these activities require a level of volunteerism. Sometimes it requires going above and beyond the work in order to look for change. And we're already sort of, you know, we have large patient caseloads. There's so much demand in many ways, and I'll speak for the social work group, but, you know, have historically been some of the lowest paid professionals within the healthcare field itself. And so supporting each other, because it really is a systemic change, by being able to access more of an interdisciplinary approach to addressing some of these needs, everyone really benefits. And so policy that supports, you know, pay parity within the healthcare system, understanding how we regulate patient care and what are the demands that are put on each discipline, those are so important as well in order to achieve some of our goals around addressing political determinants of health.
Yes, please go ahead, David.
Just want to point out in the chat, which is always so rich in these kind of meetings, that if I pronounce it right, I hope I don't mess it up. Dan Morelli asked a question about what do you do if you are at a public institution? And then happily, Aaliyah pointed to some resources from Vot-ER. And I would just say one other thing in response to Aaliyah's point, which is the first place to go to. But a second place to go to is that when it's not possible to do some activities at the local level because of real constraints that happen at the institutional level, and we don't want to pretend that there are not real constraints, in addition to the language that's very helpful on the Vot-ER website in that link, it's also important to know that the organizations like Aletha leads and the one that I'm involved in, we have a certain privilege that we can speak in a way because we're not subject to that certain kind of pressure. And so that's, again, going back to this obvious, I know, but forgive me, the solidarity idea. And Dan, we have in our organization of student reps, including voting members of our board, and an organization of resident reps. And if you want to write me and find out a little bit more about that, I'll put my direct email in the chat. And I can tell you maybe, you know, how to try to get plugged in to that group, which represents residents around the country and med students around the country. So thanks, Aletha. I just wanted to point out that was such an important question in the chat.
Yeah,
No, and Shauna, go ahead.
Yeah, just add on to that. When you have institutions and there's a concern, a reticence, you know, a cautiousness is probably a better way to describe it. I often refer to it as how, you know, when we talk about building a culture of health, it also includes building a culture of voting and making sure that your voice is heard. And oftentimes, you know, a lot of the populations that I work with either are not eligible to vote or have a really hard time voting, or they say that it can't. one of the things, that is on a national, on a state, local, it's citizenship based. But oftentimes, particularly with our high school students, they have an opportunity to vote in their student elections. If you live in a neighborhood, you have an opportunity to vote in your neighborhood association. There are so many different ways where voting, just the act of letting your voice be known, whether it's, a retail environment reaches out to say, did you like this? Did you like that? It is building that culture. And so it is talking about self-determination and self-efficacy and helping to build that skill at a very early age. And so when there is a little bit of that pushback, it's like, this isn't about being political or being involved in any type of campaigning. This is about teaching how somebody would advocate for themselves and using their voice. And voting is a really important mechanism that shows up. So when I have gotten, like I said, I haven't heard a lot of that pushback, particularly from colleagues, but I do understand reputation management. So that is, I think, a very helpful orientation, is to talk about building a culture of voting and self-advocacy.
I also want to add to that, because it's one of this, we all evolve as we do this work. And, I think my bigger evolution this year is probably around the context of solidarity, and what does that truly mean, and how do we truly show up? And so that means the language has to change too, and we have to disrupt narratives as it relates to individualism. And so even the concepts of self-care are challenging for me sometimes at this moment, when we know the structural context is also really important to what creates joy and happiness and our ability to work together. So I always kind of bring in, it's not only self-care and self-determination, but it's collective, right? It's this context of how do we do things collectively in order to drive change, but also to support one another through those change. I think those nuances in the language are really important, because the self-care part feels actually kind of isolating, in that it's like, it's my responsibility, but that's Aletha Maybank, so maybe that's just me, but that's how it feels,
That comes across as being very self-interested. And so orienting that to be able to say, you're setting an example for others, you're building the capacity for your ability to help others. And so it is, that approach of thinking about the community, and it starts with what can you do for your own health, and how does that lead? But you're right, yeah. The language is really key to helping people want to lean in, or whether they push away from it.
Yes, and what David mentioned, I think to that is really important. And as far as the fatigue, the exhaustion, it doesn't get better. There's this concept, well, you've done it before, you've dealt with all this, you can continue to deal with it, but we don't talk enough about how not really true, and it actually is really hard. So there's a question around, we're almost at time, we have a little more time, but how, Shauna, this was your question, and I want everybody to kind of answer this. This is moving kind of outside of our workspaces, but we, as health professionals, we always get asked by people, for our opinions and for our insights and our expertise, not just our opinions, from our families and friends and neighbors of, what, when they're considering, how should they cast their vote on ballot measures and policy positions and candidates, especially as it relates to health. Folks, we get lots of questions now, at least I do, from, what is that position? How are they resting on public health? They won't say public health, but health issues, or COVID or monkeypox or whatever it is. And so what is it? How do you engage with, your family, your friends, and your neighbors around all of this as it relates to health?
Yeah, well, and it's interesting. So I made a list of recent ballot measures where people asked me, because I would see it in a clinical setting. And some of it had to do with the legalization or criminalization of marijuana. We had a ballot measure recently that was looking at the rights of caregiver visits to Texas nursing home residents. And people wanted to know, well, if we let them visit during a pandemic, does that put them at risk? Like, what's the trade-off behind that? Got a lot of questions on that. We also had a recent ballot measure on public camping that was really addressing a homeless issue. And it was the way it was worded. It was like, do we ban the camping with the idea of it forces government to act and to create something? Or is that inhumane to ban that because this is the only option that they have. We had another one that was looking at property taxes on people who were disabled or who've become widows as a result of people serving in the military. So there's these really interesting, like you don't necessarily see them as health issues, but I had a lot of colleagues ask me like, how do you think that this plays out? You know, again, the nurse economist who is like, what's the clinical, what's the economic, what's the civic, you know, how does that impact our tax base? And so I have people ask me on a number of issues, what are you seeing? Like if this ballot measure passes, what's going to happen to our tax rates? What's going to happen to this population? How does that impact our healthcare system? So I'm just always amazed at how many ballot measures show up that looking at through the lens of a clinician and how that shows up, where people will come to me and it's not that they are one side or the other. They're just trying to understand, what does this mean and what will happen if this passes or it fails? And I'm like, well, I don't have a crystal ball, but let me see. But what I find though, Letha, is that it is such a rich set of conversations, and it allows people to get closer to, like, how do these policies actually unfold? You think that you're voting for something and it's going to turn out this way. And I'm able to actually say, you know, it doesn't all, you know, be careful when you're reading the language and be careful when you're looking at who's supporting that, because there are always the unintended consequences. And sometimes they're the unexpected gains. Good things happen with ballot measures that we didn't necessarily think about. And then also that downstream impact of, wow, who knew that when we restricted care for reproductive justice, that it would impact in vitro fertilization, you know, all of the other, so upstream and downstream impacts. Thanks
Absolutely.
Thanks for having been part of that discussion. Yeah.
Oh yeah, definitely. Thank you for sharing. So we have like 1 minute. I'll push to 2. This is the last question. It's probably the more provocative question of the whole session. You have like a couple seconds to answer it, but it's more so, what would you ask of not the folks within your discipline, but outside of your discipline to work alongside with you? I'll give you like 3 seconds to think. So Eleanor, are you ready?
Sure.
Okay, go ahead.
Sure. And just to go back to Shauna's response about the last question, an example is, you know, in terms of advising others around public health policy, you know, of course, stay informed, but one of the things is stay engaged. One of the things I've done over the last year is I've joined and volunteered in my local town to be on the Affordable Housing Trust group. And so what it does is it allows me to get more exposure to what's been going on the local level, but also thinking about what the stories are, what the narratives are in terms of who's asking the question, who wants to be advised, or what are their priorities really. And I think that's an important way to think about how we would guide people who are asking us these questions. But I would say that in terms of
quickly, we're really almost out of time.
Sure,
so
sure. Other disciplines,
take a little bit more time.
I think partnerships between nursing and physicians. If there's an opportunity for you to start a partnership or engage in a partnership, I think that overall will really benefit this sort of cross-sectional approach to seeing what the role of health professionals is with addressing political determinants of health.
Great. Shauna?
Inclusive language. When we are talking about our health professions, it needs to be not just physician-centric or nurse-centric or any of those. We speak as healthcare professionals and practitioners.
Great. Thank you. David?
2 things, Aletha: get out the vote. And number 2 is look at the evidence and speak the truth.
Great. Well, thank you all. It was really a pleasure and an honor to be in conversation. I had way more questions that came up, and all the things that you said, I wanted to ask more, but I had to hold myself back. But I really thank you all for your insights and your time. And just to me, again, I think building on the theme of narrative and inclusivity and all of that, and how we elevate these issues, evidence and solidarity, and getting out to vote. So thank you all, and thank you for your time.
Thank you.